Hey guys, so we are back with this series of lecture on NEET PG previous year topic discussions. This is the third question on that series. This question came in NEET PG 2022. The question read as, a man is on diuretics and the patient presents with weakness. The ECG was done which shows flattened T waves and a prominent U waves. What is the most likely diagnosis? The clues here are the patient is on diuretics. Also, the ECG is showing flattened T waves and prominent U waves. All these points towards hypokalemia. Okay. Now let us discuss the ECG changes in hypokalemia, hyperkalemia, hypercalcemia, and hypernatremia. So first of all, what are the causes of hypokalemia? The causes of hypokalemia includes diuretics like loop diuretics and thiazide diuretics. Out of them, thiazide diuretics causes more hypokalemia than loop diuretics. Other than that, the causes of hypokalemia includes diarrhea, vomiting, massive blood transfusion, and decreased oral intake. Clear? There are other diuretics which are called as potassium sparing diuretics. These causes hyperkalemia, and these includes mineralocorticoid receptor antagonist and ENaC blockers. Clear? Now let us discuss what are the ECG changes in hypokalemia. So this is the sequence in which ECG changes occur in hypokalemia. जैसे जैसे पोटेशियम लेवल कम होता जाता है वैसे वैसे ये चेंजेस आते रहते हैं. So the ECG first component is showing normal STT wave, that is normal ECG. Okay. Now in this we can see that there is slight flattening of T wave. Okay. So when the potassium level started decreasing, there is flattening of T wave, which is the earliest change. Then there is further flattening of T wave and a U wave start appearing. Along with that, there is slight ST depression start occurring. Also, P wave become prominent, and a tall P wave is known as P pulmonale because of RA enlargement. But here there is no RA enlargement. Still there is a tall P wave, so it is known as pseudo P pulmonale. Further, T wave और flat होती जाएगी and U wave becomes more prominent. In the end, T wave would not be visible. It can even be merged in the U wave and there is a prominent U wave. Okay, so this is known as QU prolongation, QT prolongation, or sometimes we can also call it as pseudo QT prolongation because T wave is not visible. Clear? So these are the ECG changes in hypokalemia. ECG changes hypokalemia and hyperkalemia के are so typical कि जैसे इमरजेंसी में पेशेंट आता है तो इलेक्ट्रोलाइट्स आने में तो इट टेक्स 1 hour. ओके, सो हम लोग क्या करते हैं कि ECG देखते हैं, डायग्नोज इलेक्ट्रोलाइट abnormalities and correction वहीं स्टार्ट कर देते हैं. So it is very important to know the ECG changes of hypokalemia and hyperkalemia. This is the ECG which is showing hypokalemia. Here you can see कि there is ST depression, there is a U wave, and there is a flattened T wave, and also there is QT or QU prolongation. So basically QT prolongation देखने के लिए तो we have to calculate QTC, which can be calculated using a formula. But grossly we can see if this is suppose RR interval and this is the QT or QU segment. So if QT or QU segment is more than half of RR interval, then we can grossly say that it is a QT prolongation. Now the ECG changes in hyperkalemia. When the potassium starts rising, initially 5.5 to 6.5 जब potassium level होते हैं, we call it as mild hyperkalemia. उस time पे there is a tall T wave. you know, and this is known as tall tented T waves, and it is symmetrical. If you divide it into two parts, then the first part and the second part are very symmetrical. Also, there is prolonged PR segment. When there is moderate hyperkalemia, that is 6.5 to 8, then P wave start disappearing, QRS start broadening. Okay. While in severe hyperkalemia, there is a sine wave pattern, or there can be cardiac arrest or asystole. Clear? So this is a ECG which is showing hyperkalemia. You can see there are tall waves, tall T waves. There is QRS widening. Also, there are no visible P waves. Clear? Now we are left with hypercalcemia and hypernatremia. So in hypercalcemia, the ECG changes QT shortening. While in hypernatremia, there is no ECG change. Clear? So the answer of this question is hypokalemia. Other than that, question can they can ask the question like कि आपको एक ECG दे दिया, तब भी electrolyte abnormality पूछ ली. Or similarly in this question they can ask कि patient is on potassium sparing diuretic or patient is on spironolactone and there are tall T waves, there is broad QRS. Okay, so this is the way they can ask the question on electrolyte abnormalities. All the best, guys. Thank you very much.